A lot of patients I see have chronic back pain. Kind of with that chronic back pain, we help them deal with it through interventional measures and also through pharmacological measures as well. I think PM&R is very much needed here. We see a lot of these patients who may have pain, also have dysfunction. It's really exciting that we can help these patients kind of get better, not just with injections, but also things like bracing needs, physical therapy needs that kind of fall within specialties, and we could really help maximize those patients, get them functioning to where they really want to be. A lot of these patients leave the hospital and they're dealt with real life and how to kind of navigate through these channels. And these can be things like enjoying time with family, maybe getting back to work, like how does a patient get there? So we kind of try to make a roadmap and a game plan for them. And that really is going to be, how can we help manage their pain and control their pain? How can we help them function better, right? So is this physical therapy, occupational therapy, speech therapy? We're kind of their backboard to help them get into a lot of these programs and being there checking up to make sure that we can get them better. I like to say, we're doctors of function. So let that be neuromuscular medicine. We have orthopedics and neurology, and I think we kind of fit in between to help these patients out and trying to get patients the help that they need as well. Pain medicine itself has been growing, especially the interventional treatments that really help patients. Having, a whole department here doing so much in so little time, like we're even starting our first physiatry residency coming up with a new class, which is, extremely important. It's going to help bring physiatry to the state, help to fill needs, and hopefully, we have a lot more doctors that come and stay, and we can kind of spread across the state to really help West Virginia. As a interventional pain medicine doctor and also as a physiatrist, I'm always trying to treat pain, but I tell patients that, pain and function go hand in hand, right? If you're in a lot of pain, you're probably not functioning too well, right? And if you're not functioning too well, you probably have pain. So sometimes it's as little as finding out what really matters to a patient. Like sometimes it could be something like just walking around the mall or spending time with their grandchildren or even just walking to get their mail. If I can see a patient kind of on their worst day and help them get back to their best day, I think that's what motivates us all as physicians, and I found that in PM&R and also with chronic pain medicine.